Hi, I'm so glad that you're interested in learning more about our PGY1 Pharmacy Residency Program at Virginia Mason Medical Center. We're really excited to share our program with you. We have a lot of things that make our program really special. We have a great combination of both ambulatory care and acute care. We also, because we have a smaller program, we only have 2 residents, we're really able to customize each resident's rotation and residency experience in order to meet their needs. We also have a lot of really wonderful preceptors that span a wide variety of clinical specialties, both in inpatient as well as ambulatory care. And our preceptors, I think, are really the heart and soul of our residency program. A lot of our residents do end up staying on at Virginia Mason. Ultimately, that should be the dream of any residency program. They've stayed on in a variety of capacities, including both in ambulatory care, both in primary care as well as in specialty clinics. They've also stayed on in acute care and are on our different inpatient services. We've also had our residents go on to other institutions and take jobs that were completely unrelated to their residency program, but fortunately we've given them all the skills they needed in order to take whatever job they wanted to.
At the startup residency, I was heavily involved in the scheduling of my rotations. Throughout the rotations, my objectives were based on my previous learning experiences and my learning objectives. Throughout the rotations, I also got frequent feedback from my preceptors and RPDs, and I've received so much support and encouragement from other preceptors, my RPD, and healthcare professionals at VM. Providers are dedicated to teaching students and residents, and they often take times out around to talk about disease states and treatment options. I feel comfortable expressing my thought process, asking questions, and giving recommendations. There is constant collaboration between the pharmacy department and other departments. Virginia Mason has a culture of teamwork and mutual respect that ensures excellent patient care.
I applied to Virginia Mason because this program had a variety of acute and ambulatory care rotations, a collaborative patient care team, and a place that focuses on quality health care and patient safety. Virginia Mason has it all. All of the preceptors have been very accessible and flexible whenever I had a question. They were able to guide me and challenge me to learn and grow. Each week we huddle with our residency program director to talk about how we're doing. We also meet quarterly to talk about the progress we made towards the goals that we set at the beginning of the program. The Wellness and Resilience program has given me the tools and resources I need to identify signs of burnout and how I can overcome these challenges.
A lot of my preceptors in the clinic and in inpatient really encouraged me to think on my own and make my own clinical decisions, and that really helped me out a lot, and they always guided me throughout the process. One of the most valuable skills was learning to be comfortable in really uncomfortable situations and figuring my own ways out of different problems and learning that critical thinking skill.
My teaching philosophy is to encourage residents to increase their confidence and their independence on my rotation. I like to model my own style of pharmacy practice through team interactions and patient interactions. I'll coach the resident and give them lots of feedback. My teaching philosophy really does incorporate tons of feedback. And finally, the goal would be for the resident to take full responsibility for the service. What I really enjoy the most is finding teachable opportunities on my rotation. I like to approach difficult clinical situations as a learning opportunity, both for the resident as well as for myself. I'm also very passionate about transplant pharmacy, and I really think that this comes through in my teaching and coaching style, and I think that this helps to increase enthusiasm and interest in the resident.
My experiences during residency prepared me to be a clinical pharmacist by sharpening my interpersonal skills through working with multiple disciplines, both in the hospital and in the ambulatory care clinics. During residency, I was given the autonomy to practice independently, and it really helped me to work with providers among multiple disciplines, and those relationships were able to be solidified and help me in my practice today.
Thank you so much for showing interest in our program. I hope that you've had a chance to learn about all the wonderful things that Virginia Mason has to offer, and we really look forward to seeing your application.